go. Sorry, I don't do these very often.
I'm definitely not an expert at Instagram Lives, but I've invited her in. Yay. And hopefully she is here.
Hi.
Hello.
Hi,
Yay.
how are you?
I'm good. It's always fun doing these things live, isn't it, on the spot? So,
It is, but it's great. It's a learning curve. I've never done an Instagram live, so here we
oh,
are.
really? Oh, fantastic. Well, I would have been thinking about you this morning then talking. I recorded my talk on confidence and how, when we do
Fantastic.
things for the first time, it can be quite
Yeah,
tricky and feel really uncomfortable, but that's all part of it and that's okay. So I'm glad you're here.
exactly. Couldn't agree more.
Well, lovely to have you. And I know you don't have very much time, so let's sort of get into it. I'd love to just ask you quickly, Deepa. I mean, you're part of Sydney Low Carb Clinics. Obviously, low carb is really important to you. So, are you able to give us a bit of just a shortened version of what took you as a GP into the low carb space?
Sure. So for me, it was a personal journey to begin with, like it is for many people who ended up finding low carbohydrate medicine. And in my experience as a GP, I was just seeing a lot of disheartening practice of medicine in the sense that you would see a patient and not really be able to ever discover what the root causes of their illnesses were. And a lot of it was a patch up job. So either a prescription of a medication or giving advice of eat less, move more, which never really seemed to be effective. So that's sort of one of the reasons what sparked me to look into it. But then also from a personal standpoint, I've had my own history with endometriosis, and I was always looking for a treatment that I could use in conjunction with the standard medical treatment for the condition. And, fast forward a number of years, I've been able to keep that in remission because of my dietary changes, in addition to normal standard management. So that was a personal journey that kind of sparked it, as well as just seeing that it could work really well with people in my practice and seeing some of the benefits. And then I guess also, from a standpoint now, because for me, in terms of my health, I'm at a point where I really want optimal health and longevity and want to prevent things that are quite strong in my own family history, which is heart disease and type 2 diabetes. And that's actually quite, a concern for many Australians, many people around the world who want to prevent these illnesses, which unfortunately are becoming far too common. I think the last statistics were that 93% or more of the population has some form of chronic illness. And that's not a way to live, and it's not a full life that's led either. And I think this is more becoming, like, that was at the forefront of our thinking. So together with my husband, Dr. Alex Petrushevsky, so we set up Sydney Low Carb Specialists for the very reason of trying to bring this medicine to more people and to provide a holistic approach to giving people not only some tools to reverse what they thought were chronic diseases, like type 2 diabetes, which we now know can be put into remission, but also tools to improve their health. So they're not just functioning at 50% or 75%, they can really get to where they feel that they're getting everything they want out of life, and they can be there for, lots of key moments in their life, with their grandkids, their children, their partners, their friends, their community. And being able to be part of that really is underpinned by good health. So that's sort of where that has, I guess, come together for us with this clinic. And also what we see more and more now, because we know that low carb is becoming a very well-known way of treating illness. And so the extension of that is, how can we make it a sustainable way of also continuing to keep illness under control and to go on in the long term as well. So that's more now where we're turning our focus to at the clinic as well.
Awesome. So much in that. So firstly, obviously prevention. I'm glad you mentioned that. I think, I was propelled into it because of ill health, and I think we are, but I think now we know what we know. It's really about getting the message out there that absolutely we don't have to wait till we get the diagnosis or we start to feel unwell, you know. And if we do sort of follow the recommended dietary guidelines, you know, it's kind of taking us on that path, so we can kind of pull up and really learn a lot more about the impact of nutrition and lifestyle on it, so that we just don't even get there. I mean, amazing that is the possibility for people to learn about. But also, how much has your practice changed? I mean, you're talking about how you practice medicine now. I mean, just so different to probably what you thought you would do when you first came in to medicine.
Yeah, it's a real turnaround, and that just goes to show that all health professionals can adapt and change and really colour their practice with what we can see in the literature, but also with what we see in day-to-day practice. And I think it's important because I think what's ingrained in us when we graduate from medical school is everything is guideline based, that we have to stick rigidly within the guidelines. And yes, they are there for safety, and that's certainly fundamental to my practice. Is it's always a first do no harm approach. But what we have to recognize is sometimes we don't have those decades to really be waiting for well-constructed randomized controlled trials to prove the benefit of something that we can see is happening already in a patient who has chosen to go and take this approach and have had outstanding success. And I think that's where we have to be dynamic and adaptive with the way we practice medicine, and anyone who's in a health professional space should be open to that curiosity of going, oh, what was it that actually helped you improve? You know, it didn't really seem to be the standard management, but you had done something else. And I think sadly, maybe that curiosity gets lost the longer people are practicing medicine. And I hope, you know, that people, health professionals themselves, you know, often all of them are curious when they start training, and that curiosity maybe gets lost, and it's a bit sad that then they don't want to really see more broadly and look a little bit beyond the guidelines and see, okay, how can we actually marry those things up and do it safely, give supervision to these things, and help people adopt some lifestyle changes that are actually effective. So I think it's just, I think, yeah, we have to kind of get away from, it's not just evidence-based medicine, but it has to be evidence-informed, but adaptive to what we also see actually happening day to day in our clinical practice.
Yeah, yeah. And that curiosity, it's so inbuilt in all human beings. And you're right, I think we just kind of lose it. But, you know, I think listening to someone like you know, I mean, that is, you never know who that's going to spark. I mean, could to spark them to reignite that curiosity again. And I think it's fantastic what you and Alex do. And obviously, you know, I love your work, and I'd love to know within the summit. So you chose the topic of thyroid and understanding what happened, or, you know, what low carb can do with understanding our thyroid. So why did you choose that topic, and then what are you going to cover? Well,
it's a good question. I actually chose it to kind of give me a little bit of a kick to go and do a bit of a deep dive myself into thyroid function, because I think in the last 2 years, I mean, our clinic's been running for 3 years now, but more so in the last 2 years, I've been observing thyroid function changes with our patients over time. And I wasn't entirely sure what was provoking those changes, and it never really seemed to add up to any health negatives or ill benefits, but they did seem to appear. And even when I did some cursory research last year, and I couldn't find really that much, and I thought, well, this might just be the opportunity for me to go do a bit of a deep dive with the summit and find out a little bit more information and translate into my practice, but also to provide a framework that people might be able to take away from the talk to look at their thyroid health. So, for instance, some of the most famous criticism of a low-carb diet within the impact on the thyroid function is that it could either make somebody have or develop an under-functioning thyroid, or it could make existing underfunctioning thyroid problems worse. So that seemed to be a bit of a criticism that's evolved over a period of years based on some literature that wasn't actually looking at low carbohydrate diets. So it's looking at other contexts that might replicate a specific form of going on a low carb diet. So that specific form that I'm finding in the literature is more the one that mimics starvation. So this is the nuance, I think, that I want to bring to the summit and discuss that, yes, a low carb diet is a spectrum, and it can, all forms of a low carb diet can actually be done in a calorie restricted way, which is energy restriction. And it seems to be that this causes a specific type of dynamic adaptive change to thyroid function that suppresses TSH, which is the thyroid stimulating hormone. And that actually doesn't come from the thyroid, that's coming from higher up. So it's coming from the pituitary gland within the brain. And so it's been observed to get suppressed in the setting of starvation. So starvation, which would mimic calorie restriction, that's done more than 6 or 8 weeks in duration. So that chronic form of starvation, yes, sees a depression in TSH, sees a depression then in T4 and T3 hormones, which are coming from your thyroid gland. And then also subsequently at a cell level where the thyroid hormone, which is active, which is T3, it actually cannot bind to those cells effectively because you get downregulation of thyroid hormone receptors, and the protein binding capacity of that thyroid hormone is also reduced. So what's the point in making the hormone if it can't enter the cell where the cell can then produce the energy? So it's actually responsible in mitochondrial function and number. And it's also responsible in the transcription of specific genes, and a whole raft of other cellular processes are basically conducted and by the thyroid hormone. And if it can't get into that cell, then you get downregulation of lots of bodily processes and the slowing effect that people describe when they have underactive thyroid, hypothyroidism. So that's something I wanted to explore because I think it's important to unpick what it is about a low carb diet that could cause these impacts. And when we see someone who might be vulnerable to that because they might already have been on a long-term calorie restriction, or they might have been coming into this doing a form of a low carb diet that was intentionally or unintentionally mirroring starvation, it's really important to correct that fundamental aspect, because that does reflect on thyroid function panels, and we see that change when we make that slight adjustment. So I think it really, to summarize, I think it's the specific form of your ketogenic or your low carb approach that can actually, the way you do it can minimize the risks associated with changing the thyroid function in a negative way. And then one of my interesting conclusions, I don't want to spoil the talk itself.
Not too much.
Not too much. But one of the interesting conclusions on the flip side of all this, of my deep dive into this literature, is that a very recent article, and I talk about it in the talk, that was published in June 2002, this article was actually looking specifically at a ketogenic diet and its effect on the thyroid function, and it did note a change within the T4 and T3 hormones, still seen within the normal reference ranges that you see on lab tests for your T4 and T3. But what it found was it actually conferred a metabolic advantage, if anything, this change, to the participants in this trial. And I thought that was really interesting because, yes, it did change the thyroid function in a way that some people may interpret as like slightly abnormal, or as a change to what they thought was their normal, but it actually made the individual more metabolically healthy, and it improved insulin resistance. And I'm sure we're going to hear heaps about that concept within the summit. But I thought that was a really interesting study and an interesting thing to translate to practice, because yes, it's not just that really low carb done well doesn't do harm, but it's also that it actually improves your metabolic health in the long, like short, medium and long term. So I thought that was really an interesting find, which I put into the talk so that people could see what are the benefits even of actually eating on a low carb approach when you do already have a thyroid problem.
Fascinating stuff. I think that's so much that will come out, you know, down the track of how, you know, understanding different, you know, markers and, you know, what we've sort of go on when people are eating a standard diet as opposed to a low carb, that there may be some differences and nuances around that, which that, you know, is just a great example of it. Does it kind of still come back to how we're feeling? So if you've got a patient feeling really good, but their thyroid panel is showing a slowing down, and you think they're eating a well-formulated ketogenic or low-carb diet, is that something you would just kind of, well, it's just possibly not a problem?
Yes, I think the context matters a lot. So how someone describes their day-to-day function, and because especially with any thyroid conditions, the symptoms are really vast, but they affect the entire body, and you'll have people who have only some of those symptoms. So they might only have cognitive effects, or they might only have scalp changes or gut changes as a result. They might only have weight gain or weight loss. So it's not that you have to tick off every symptom to really have some suboptimal function within the thyroid. But yeah, in the setting where someone feels really good and you see some abnormal readings, it's very analogous to someone who sees lipid or cholesterol changes on a low carb diet, where every other metric has appeared to be, by the standard conventional ranges, normal. And that is a really important art to low carb medicine, which is evolving. And I think Finney and Violet put it really well. It's, you know, the art of low carb living, the art and science of it, because it's not a hard and fast set in stone, this is the narrow range you need to be in. But if you're feeling well and we see some numbers, we often default to the side of it's actually the feeling within yourself, and that you can perform all your activities of daily living and you feel vitality as well. Those are so critical and important to when we assess someone. And if someone is already finding that nothing is limited and they have that boundless energy that we hope we can help someone to achieve, then the numbers really need to be put into that context. I think the last thing to that point is thyroid function is very dynamic. So we might measure it one day and it could be very different the next morning, could be very different in a month or a few weeks' time. And it is because it's the thermostat and it's going to change. So we often don't make changes based on one number. It really needs to be an observed pattern over time that might prompt us to intervene. But I think that's also important for people to understand, is it's not just one panel, just a decision made on one aspect, has to be put into a number of different metrics as well. So, and also monitoring it over time, looking for patterns as well.
Yeah. Brilliant. I think it sounds incredible, the deep dive you've done. I'm so grateful that you've done it, and that you're going to get to share it in the summit. I think you're so right. I think it is an art, you know, and we need to find how it works for us optimally as individuals. I mean, you know, say it every day virtually, there's no one size fits all, and we need to, you know, to have someone like you in our pocket, you know, while we're trying to navigate it is incredible. And yeah, so thanks for joining us today, sharing the information, being forefront, you know, really in navigating this art to make it easier for others to follow you. You know, it's fantastic the work that you and Alex do, and really looking forward to you talking the summit. Thanks so much, Dr. Deepa.
Thank you, Tracy. And I'm looking forward to hearing a lot of the talks at the summit. I think you've curated an amazing array of subjects and topics. So it's going to be very interesting.
Yes, it definitely is, and it's getting you know, very close now. As I said, today's the
Yeah,
last day for the
in a
early
week.
bird price. Guarantee you, it would be money you would never regret spending. It's just shaping up to be brilliant. They're just There's just so much amazing, you know, people like yourself out there doing incredible work, and it's just showing people that there's more opportunities, there's more things to see, and why wouldn't we want to see it, basically? So
Yeah,
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 yeah.
that's true.
Thank you. Thank